Good morning. My name is Dr. Stephanie Page. I'm a pediatric gastroenterologist at Overland Park Regional Medical Center. I've been asked to talk to you today about when is a tummy ache not a tummy ache. So first off, abdominal pain can be a very scary symptom for parents as they are not sure, is this something to worry about? Is this not something to worry about? And I hope I can provide you some information to help you figure out when you should be worried. So the first thing to really look at is how often is your child complaining of abdominal pain? So if it's just once a day here and there, you might make a note of it and see if it continues. Or if it's starting to become more frequent every single day, then definitely taking a note of that and letting us know is helpful. So abdominal pain that occurs here and there is not something that I typically worry about, but something that's occurring every day, lasting for several weeks, that needs to be evaluated as there can be many things that are causing your child's abdominal pain. So the first thing to think about is how often is your child pooping? So constipation is a very common cause of abdominal pain. And I think evaluating your child's frequency of pooping is very helpful. So knowing whether they're a daily pooper, every other day pooper, a couple times a week pooper, those are all very helpful for us. Other things to consider would be, is your child having a fever? So if they're having a fever, that can be a sign of an infection. Whether it's viral or bacterial remains to be seen, as sometimes there can be other symptoms that come along with that. But fever and abdominal pain suggests an infectious etiology, and is only if those symptoms don't resolve that we start to worry or recommend workup. Other things for us to consider for belly pain would be, is your child having nausea? Is your child having vomiting? And if they are vomiting, is there a icky color to it? Is it red? Is it black? Is it green? Like neon green, not like yellow or mucousy. Those I don't worry about, but red, black, green, those colors are concerning when you're vomiting. Other things to think about is, does your child's appetite change? Is their appetite less? Is their appetite more? Do they feel better when they eat? Do they feel worse when they eat? So timing around mealtime is helpful. Also figuring out if there is a particular food that is causing your child's abdominal pain. So every time they're eating milk, every time they're eating wheat, is their food getting stuck when they swallow? Those can be concerning symptoms and signs. Other things to think about would be, is your child losing weight? Is your child having fevers here and there without any other signs or symptoms? Does your child have recurrent canker sores in addition to abdominal pain, diarrhea, weight loss? Is there blood in your child's stool? Is there a lot of nausea or localization of the abdominal pain? Those are things to think about and show yourself to your regular doctor's office first. And then if your symptoms typically last longer than 6 to 8 weeks, you'll get referred to a pediatric gastroenterologist. However, if your symptoms are super severe, definitely a trip to the urgent care or emergency room could be warranted and might make you feel better. Hopefully these tips are helpful in allowing you to navigate the next time your child has abdominal pain. Good luck.